Hello, I'm Dr. Scott Trenhaile. I'd like to take a few moments to discuss with you some important aspects about your upcoming surgery. Please feel free to stop the video and take notes so that we can address your concerns prior to your procedure.
Hello, my name is Alyssa and I'm part of Dr. Trenhaile's nursing team. Prior to surgery, you may be asked to obtain lab work, a history and physical from your primary care physician, and/or clearance from other medical specialists that you are under the care of. Directions for all blood thinners should be coming from their offices. You may also be asked to obtain and use a preoperative skin prep solution prior to your procedure. If you have any questions or concerns, feel free to contact our office.
I'm Michael Gilbertson, Dr. Trenhaile's physician assistant. The day of your surgery, please come to the procedure with a driver that can stay throughout the entirety of your care if an outpatient procedure is to be performed. Please make sure to wear loose-fitting clothing that is easy to put on after your procedure. Once you enter the preoperative holding area, you will be asked to change into a gown and a nurse will place an IV. In the holding area, you will meet with the anesthesiologist. This is your opportunity to discuss the type of anesthetic you will be receiving for your procedure. Knee surgery patients typically receive general anesthesia in which you will be completely asleep. In addition, it may be recommended that a regional nerve block also be given in combination to the general anesthetic. The block consists of an injection given in the thigh of the operative knee after a sedative is given. During the block, you will be able to breathe on your own, but be unaware that the block procedure is taking place. If a block is recommended, it should provide knee numbness that typically lasts 12 to 24 hours in duration. This will allow you to start your oral pain medication at home as directed while the block wears off. Starting the oral pain medication as the feeling in the knee begins to return allows for a smooth transition between the regional block and the oral medications. Side effects of the block include not only numbness of the knee and leg, but also the inability to move your knee, ankle, and toes. The inability to move your leg typically resolves when the feeling returns or possibly sooner. In the preoperative holding area, Dr. Trenhaile will come and meet with you and sign your surgical site. At this time, you will have the opportunity to ask any final questions before you receive any sedative or anesthetic medications. The surgery is an arthroscopic assisted procedure which requires the use of multiple portals placed around the knee as well as a midline incision over the front of the knee to access the graft that will be used for your ACL reconstruction. The portals are small incisions in the skin about 1/4 inch in length which allow access to the various compartments of the knee. A diagnostic arthroscopy is performed, photographs of the knee are taken, and you will receive a copy of these photographs on your first postoperative visit in the clinic. By this time, your graft selection should already be decided on, that being autograft, your own tissue, or allograft, tissue from a donor. We will be using patellar tendon graft that contains bone blocks on both ends and the tendon in the middle that takes the place of your torn ACL. During the procedure, the structures within the knee are evaluated and any significant injuries are identified and repaired during the surgery. This would include any tears in the meniscus that are found. Tunnels are then created by drilling through the shin bone and the thigh bone. The graft is passed through these tunnels and secured with screws to replace the original ACL. Typically, bioabsorbable screws are used. These screws slowly absorb into your native bone over time. In rare circumstances, we may encounter the need to use metal screws if it is determined to be best for your surgical outcome. The incisions are then closed with sutures and covered with a white absorbent dressing. The surgical portion of your procedure will take approximately 1 to 2 hours to complete depending on your operative findings. After surgery, you will be placed into a knee immobilizer. Your brace will be worn, fully extended or straight at all times, day and night, except for times that you are exercising or showering until otherwise instructed after your first postoperative visit. Plan on wearing the brace for approximately 6 weeks after the surgery if any type of meniscal repair was performed. Crutches are usually recommended to assist with walking. You are allowed to bear as much weight as tolerated on the operative leg unless otherwise instructed with the brace on and locked in full extension. So please do not walk without your brace on. You will be given written instructions before leaving the facility on the day of surgery detailing the limitations that are specific to your procedure. A white absorbent dressing will be placed over your knee. The dressing is applied to keep the portals clean during the healing process Immediately after surgery, the fluid that is used to distend the knee will leak from the portals and it is then absorbed into the bandage. Occasionally, the fluid will leak beneath the bandage and a towel can be placed under the knee to soak up the fluid. The bandage should not be removed, but instead reinforced with more bandages or a towel. Occasionally, the fluid that comes out of the knee is blood-tinged in color. Don't be alarmed, as this is fairly common. If you have any questions or concerns about the amount of drainage that is occurring, please call the number that is provided to you. The absorbent bandage may be completely removed 5 days after surgery and you may take a brief shower. Swelling is a very common finding at this time. The knee immobilizer is removed and touch-toe weight bearing on the operative leg is allowed for balance. You will likely require assistance getting in and out of the shower your first couple of times. At this point in your recovery, I do not recommend any prolonged exposure to water, including bathtubs, swimming pools, or hot tubs. After the shower, you may towel dry the surgical site and apply Band-Aids to all surgical sites. Please do not try to clean the operative soap from your knee, as it has to exfoliate and wear off with time. Early exercises are allowed to begin the rehabilitative process. It is not uncommon to have your first physical therapy appointment prior to seeing our team for your first post-op visit. You may begin exercises at home 24 hours after surgery to include quad sets, heel slides, and ankle pumps, unless otherwise instructed. Performing ankle pumps continuously throughout the day will help to reduce the risk of developing a blood clot in your calf. It is safe to bend your knee in a non-weight bearing position when performing exercises unless otherwise instructed. Elevation of the leg above chest level will aid in the reduction of swelling and help to reduce the pain in your knee. Avoid driving until you are seen back in the office at the 7 to 10 day mark after surgery. Further recommendations may then be given on your first postoperative appointment. During this visit, we will discuss with you the arthroscopic photos that were taken at the time of your surgery and also discuss the next steps in your rehabilitative process, including physical therapy and brace timeframes. You may have sutures that will be removed on this visit as well. While each circumstance is unique, patients are typically prescribed postoperative pain medication and nonsteroidal anti-inflammatory medications. We will provide you the prescription of your pain medicine today to assure timely filling of the medication prior to surgery. We ask that you please do not take the pain medication until after the completion of your surgery. These medications are for home use only and will not need to be brought with you on the day of your surgery. The medications are chosen so that they may be taken together safely as long as you follow the directions on the pill bottles from the pharmacy. Basic risks associated with any surgery include, but are not limited to, things like blood clots, infections, failure of the procedure, implants, nerve damage, and need to repeat surgery. You will be given a dose of antibiotics through your IV before the surgery to reduce your risk of infections. If you are experiencing fevers, chills, night sweats, or excessive draining from the incisions, please call the office immediately. As we get closer to your surgical date, your time for surgery will be released. If your surgery is on a Monday, you will receive a call from our office prior to 3 p.m. on the Friday preceding. For all other surgery dates, you will be notified by 3 p.m. the day before your surgery. It is important that you inform our healthcare team of all medications that you take on a regular basis, including supplements and over-the-counter medications. You may be asked to stop some of these medications prior to surgery. Remember, nothing to eat or drink after midnight the night before your surgery. Thank you for your attention, and we will now be in to answer any further questions that you have.